everyone. Thank you for joining us on this very lovely, beautiful spring day. Yes, maybe, almost. We'll get there. I'm Chelsea Oliver. I am the Director of Marketing and Community Engagement here at the Jefferson. So thank you for joining us during our community conversation series. Just a couple housekeeping things if you have not done so already. If you purchased a lunch, please help yourself. The coffee will be ready in a moment. But if you would like some water, there is some over there as well. And if you heard on the way in that there is no running water in the building, that has been alleviated, and you may use the restrooms if you would like to. They are out in the lobby to the right up the stairs. So we will be doing Q&A a little bit differently today. Normally we wait until after the presentation to take your questions, but our lovely hosts today would like you to be a part of the conversation as it is going on. So feel free to raise your hand at any time and ask them a question, but please still make sure that you wait for a microphone to get to you from either myself or Time, and then everyone can be sure to hear the question. One other thing, I want to direct your attention to our winter term brochures. We have nearly 20 more programs to get you out of your cabin fever in the next month or so. Welcome you to join us here and at our 4 other satellite locations throughout Erie County. And then finally, I will introduce our speakers. So first we have Pat Stucke, who is the Mental Health Association CEO, Colleen Hammon, who is the VP of the board of the Mental Health Association, and Betsy Wiest, also a board member of the Mental Health Association. So I will let them introduce themselves and the organization. If you all join me in a warm welcome from the JES.
So I'm going to try not to be too loud. So let me know if you cannot hear me. I'd like to not have this, but they told me I have to have a microphone. So I'm Pat Stucke. I've been at MHA for 12 years. We've been in existence for 30 years. And we always talk about that we're the best kept secret. We're on 11th and Peach Street, and we do a lot of different services that we'll talk about today, but primarily around what we call as peer support. So, Colleen.
Away from that pole. I am Colleen Hammon, and I am Vice President, wanting to be Vice President of the Board of Mental Health Association, because I firmly believe in it. I'm the Director of the Intellectual Disabilities for the county, as well as mental health, and so consequently, my love is for supporting and finding different ways that we can support people who might have those mental health challenge, as well as sometimes homelessness or substance abuse issues. So I'm delighted to be here.
Hi, everybody. I'm Betsy Wiest, and I am a board member of the Mental Health Association. And I have worked in the mental health field my entire career. I go back to days at Stairways, and I ran St. Patrick's Haven, and I have a real heart for those who are walking that mental health road, especially those who are experiencing homelessness, because that's kind of like a double-edged sword for them. So we're here today to talk about that piece of it as well. So Pat, I'm going to let you get started.
Great, thank you. And thank you for coming in. It's nice to see a lot of familiar faces too. So what we want to share first and foremost is actually our video that we have. If we can, we're going to do this a little bit differently. As the board knows, I never go by the agenda the right way. I always kind of pick and choose. So we're going to start off. It gives you an idea of the services that we have at the Mental Health Association. And we affectionately just call it MHA, just easier to say.
Sometimes life throws you or someone you know curveballs. You might be facing mental health challenges or perhaps struggling with addiction. Maybe you just need a supportive place to help with these challenges.
The Mental Health Association, or MHA, is a safe and accepting place. Our staff and many members understand these struggles firsthand. We've all walked similar paths and possess the experience to support you on your recovery journey.
I've been a member at MHA for a year and a few months now. And when I first came here, I was very nervous about coming here. But since I've become a member for the past year and some months, they have made me feel real welcome. They're very understanding folks. And I like most about them is they can really conspire with me because they can understand where I'm coming from because they've already been there and experienced things I've already experienced.
Yeah, so the MHA, I've gotten a front row seat to the sort of things that the MHA does in this community from a couple of different viewpoints. So first and foremost, I'm a recovering alcoholic and addict, and I'm also, I have bipolar disorder, and I'm in recovery from that as well. And so for the longest time, I wasn't really doing anything positive with my life at all. And when I finally hit rock bottom and went to rehab, the first place that I went after I got out of rehab was here to the MHA for an AA meeting, which turned out to be available every day of the week, which was a lifesaver for me. I very much needed to be in a meeting at least once a day for the first 90 days of my sobriety. And I spent each of those 1-hour sessions on the second floor here at the MHA, where I met my sponsor, and my life was literally saved. I don't think I missed a meeting for probably the first 3 years of my sobriety, and for that I'm forever grateful to the MHA for being here and having their doors open when I needed them to be. Flash forward a few years, I ended up working with folks experiencing homelessness and chronic addiction and chronic mental health issues as the director of the Our Neighbor's Place seasonal overflow shelter program with the UMA. And the year that I started, UMA was actually partnering with the MHA to house a couple of weeks at a time for three or four sessions that shelter. And the year that I started, we actually had the shelter down in the basement, and it was just incredible to be able to work with Pat and her crew and to see how accepting and flexible they were with us as a program and with the folks that we housed through that program, because as you can imagine, folks that experience chronic homelessness, chronic mental health issues, and chronic addiction, often behavior can be challenging, and we never found a friendlier place than in the MHA. In terms of having a venue and a host that knew our population and was willing to go above and beyond to help us provide care for them in all of the best possible ways.
We are dedicated to making sure everyone feels not just welcome, but supported. We offer many activities at our Consumer Recovery Center. There are opportunities to volunteer if you are looking to give back. You can even do laundry or take a shower. All services are free. Yes, free.
More importantly, you'll connect with like-minded individuals who will help you to develop a strong sense of belonging and coping strategies to better handle those curveballs thrown at you. You can be part of a community that knows the importance of mental health and addiction recovery.
The Mental Health Association is here for you. We offer a safe and welcoming place with experienced professionals ready to listen and share their experiences.
So that's just a little snippet, and the primary focus in that particular commercial was about what we call the Consumer Center, which is our daily drop-in center. So we'll talk more about that program, but I want to focus on a few other things too. If you can go ahead. So this is the building you've probably seen downtown and wondered, what the heck, who are these people? We're right smack on 11th and Peach. And so, again, we've been in that building for over probably like 25 years. So it was a real grassroots movement way back when, and I'm going to say started in 92, and then actually became a corporation in 94. So we provide services to adults 18 years and older. We have what we call as a low barrier threshold, and that is a simple way in. So what you need to do is just show us like a photo ID, so we verify your age, you are who you say you are, and that you can also show some either past or current involvement with mental health services, treatment. That simply can be just a pill bottle. That's it. We know what the medications are. Or if you don't take medications, then it is simply, who have you received services from? Where at? And then sometimes we need to get a release to get a little bit more information. But our focus is to get people in as quickly as you can be, because when somebody ends at our doorstep, we know that they need help. They need to be someplace safe. And that is our focus, is, again, to keep a safe environment for all of us who walk through the doors. So I know Colleen and Betsy will jump in, because if not, I'll just talk the whole time. So I think what I wanted to focus on is our mission, and we'll explain that as far as the services that we provide. So when you look at that and you read that, let me give you an example of what that means to us. And that is, let's say that you were just recently diagnosed with cancer. Who do you want to talk to? Besides first talking to your family and your friends. Usually then you want to take that step and talk to somebody who's gone through that experience, because you want to be able to connect and see if they can help you navigate everything that is really complicated at that point. That, in essence, is what is considered to be peer support. So we walk the talk. So we have, I believe there's 24 of us who work at MHA. All of us self-identify either as having mental health issues, mental health needs, past history with substance abuse, may have been homeless, and or current and past history of criminal justice. So we're a place of hope, because certainly believe in giving people an opportunity to give back to the community. We, I think, can connect with people in a way different manner, because we can have pretty strong conversations with people. Been there, done that, we get it. So it certainly helps for the board to make sure that we are walking that path.
Pat, can I jump in for a second?
Sure.
One of the things that you will notice when you walk into the MHA is that, yes, these are people who are dealing with really hard realities of life, but when you walk in the door, what you see is joy, and what you see is camaraderie and friendship and fellowship. And to me, that is just such an incredible gift that our guests, our clients, give to one another, is this ability to, even though they're walking this hard road, they are able to find joy in everything. And that environment is so promoted at the MHA. We are looking for ways to lift people up and to let them know that there are pathways to hope and pathways to growth.
So we'll come back to the biggest program, which is what Betsy was talking about, is our consumer center. So I just want to talk a little bit about our other programs. So the one that most don't know about, and it's only been maybe a couple years, is the peer navigators at Blasco Library. So we have 2 staff that are up on the 2nd floor. They are certified peer specialists, which means that they can connect. They're there to help. As soon as you walk through the door, you're a library patron. You need anything, just go upstairs to the 2nd floor or ask the main receptionist, where can I be in touch with the peer navigators? So we work on a bunch of different things, and we're there 7 days a week. 2 nights we're there on Tuesdays and Thursdays till 7, but also on the weekends. We have a lot of people that flow through, and Margaret and Jerry probably see at least about 150 people a month, with various needs. Sometimes it's just, can you help me get on the computer? Can you help me sign up for this? Can you help me with this? Sure, we've got time. So that's their focus, is to connect people with resources. We have, in addition, the consumer and family satisfaction team. So if you remember going to the mall and you would run into the person with the clipboard who was going to ask you questions and you put your head down and walked away, that's us. But typically we are calling on the phone, or we'll go to a provider. So our local Department of Human Services kind of sets out the number of providers, like who we go out to contact. And our main focus is to see, is that family, is that person, is that adolescent happy with their services with either mental health or drug or alcohol? So we have kind of state mandated questions that we ask. Also, we give an opportunity for the individuals just to comment, just to share something. We then, if there's anything that is of like a major concern, we're immediately contacting like our local Department of Human Services, Community Care, Behavioral Health, and say, we're recommending that you do a follow-up. We provide all of that information back to all the nonprofits in an annual report, which gives them an opportunity to really see how their clients, members, guests feel about their services. So we're thankful that we can do that. And right now we're doing a little over 1,100 surveys every year. Next, what we have is our peer support program. And they are, if you want to say, like case managers. They work one-on-one with individuals who have a mental health diagnosis. And again, want to work on certain goals. So we kind of work and walk hand in hand with that individual. And that's, again, agreed upon path. And that individual, we say, is a peer, and they guide us. They make sure that we're stepping along in the same direction. And I believe, if I've remembered correctly, outside of the center, our other program is at Warren State Hospital. We have an external advocate, and she works with all patients, not just from Erie County. She works with 147 patients from the point of admission to discharge and everything else in between. So she is making sure about the person's rights. And so we kind of jump into the middle of things. So we're in between the patient and the staff at the hospital. So we're thankful that we are able to have that voice.
Can I add something?
Oh, yep.
In my past life, through mental health, I was responsible for Erie County discharges at Warren State Hospital. So I'm just going to hop in 1 second to share with you why this external advocate position is so important. In the old days, remember pre-92, which is part of how the Mental Health Association came to be, as part of the step down and the shrinking of the state hospitals back in those years. The Mental Health Association was formed as part of that service support for the community. But in addition, I wanted to share that we have 44 beds now at the state hospital. We used to have 600, then went to 300, down. We have 44 beds for Erie County. Why this external advocate position is so important is that if I'm on the inpatient unit and I cannot be stabilized, then the doctors and Erie County Care Management, who also work with the hospitals and doctors to determine level of care need, it may be that I need to go to Warren State Hospital. However, I'm going to think of my friend John. If my friend John, right, is currently at Warren State Hospital and his need is less than mine at the door, then John flows out and I come in for stabilization. Because now the state hospital is the stabilization model, right? So the reason I bring that up is that without the ability to have a liaison and an expert, Tina is, who works at the MHA, at the state hospital to do that kind of liaisoning, it may be the doctors are thinking, gee, John's ready to go. Without Tina's input in that whole treatment team to discuss that, we might not have a clear and hopeful plan for John when it comes out. Or it may be that her intervention might be, whoa, I don't think John is ready. He needs, this service, or he needs access to that, or maybe his meds need a little bit more. So that conversation from someone outside who can be a clear-sighted expert on what is needed at the state hospital. I mean, having worked in that field, I can't say enough for not only the fact that she's there, but the fact that Pat has hired a woman who is excellent in that role. she can make connections, she can have those conversations that are difficult. To be sure the level of support flowing out from that state hospital is sufficient with the essential resources so the person can walk, so John can walk back into the community with the supports he needs. And I then can go get the support I need at the state hospital. So I don't want to go more unless there's a question. But
There was a
I want to
question.
realize how important that role is to the whole community.
We have a question here.
I chair the Erie Veterans Behavioral Health Council up at the VA, and you might get a couple questions from me this afternoon. But your peer support, as I understand, are all individuals who have gone through recovery? Okay, good.
That's always a good question. We have some individuals have only gone through like mental health recovery, but also then we have certified recovery specialists who've gone through the substance recovery. So we have kind of a cross section.
We have another question, Pat.
A lot of this is new to me, but I'm thinking going from hundreds of beds to 44, does the need ever exceed the 44 beds? Like I could see maybe if you're triaging, somebody may be less, but they still may need to be there. So what happens then?
Let me grab that. And look, my mic's on. Amazing. I have a pretty big mouth, but mic's helpful, right, Jim? Yeah, just a bit. So that's an excellent question. And although I don't want to go too far sideways, I would like to take a second to answer it. So with those 44 beds, here's what happens. The regional counties especially, if, for instance, John was not stable enough to come, right, and no one else were of the 44, but I do need to come in, then we have a system whereby we can borrow beds from other counties. So if, if Westmoreland has a bed, we could borrow Westmoreland's and we can share with them. So there is a situation where we are able to be sure everyone gets the appropriate level of care. Because you're right, what if I was 44 and couldn't get, 45 and couldn't get in? So there is a strong discussion around that, and again, that's why Pat's advocate there at the state hospital is essential to us to be sure that stability has occurred and those community supports are in place before anything changes. So we borrow beds once in a great while, there is no bed to borrow, and we just work it out and the person goes until stability is accomplished. Yes. Yes. Yeah, you're exactly right. Mm-hmm. I
We have
see Pat
another
had a
question.
question.
Okay, isn't it very expensive when we maybe quote borrow beds from other counties? Or isn't Erie County responsible for paying the cost for that bed, for that individual?
Do you know what? That's an excellent question, but the way the funding occurs, it's not individualized like that. So it's an in and out flow, and the funding for the state hospital is not individual to the person. It's state. It's a state overflow
what about
funding budget.
like somebody's number 44, they're ready to step down to go to maybe assisted living, maybe not being able to live on their own right now till they get the necessary supports.
Sure.
There's been a tremendous decrease in funding for personal care homes. A lot of them recently have closed.
Right.
In most, the reasons I've heard from individuals that own these places were because of funding. The wages were low, the state wasn't reimbursing a high enough rate for a livable wage for the direct care providers. Where does the funding come in?
Okay.
Where do the individuals that maybe can't live on their own, can't get into an assisted living program? You know, what happens to these individuals that may not be able to get enough support or need a lot of support? Because I know with the cognitive delays individuals, for funding, they get waivers.
Right.
To the individual. Now, is
Right.
this something that the state or the MHA is advocating for individuals who are mentally ill to get the funding directed towards that person with a waiver? This way, the individual, when they step down, they would be able to get more center direct resources, and that funding would be for that individual.
Right.
You know,
Pat,
to
those are
me-
good questions. Let me just, because I know that there's a lot to go, but let me answer that, because those are excellent questions. And I know from your knowledge, you know a lot about the system, so that's why you're asking that. So for mental health, you're right, some of those monies have been decreased, but we have multiple opportunities for people stepping down. One is Stairway still has what we call an enhanced personal care home, and they have a personal care home still at the corner of 8th and Walnut, where they do provide hands-on extensive care for individuals who need that. Also at the top floor, there's what we call an LTSR, which is long-term residential living. So we have, structured residential living. So we got that. Erie County is one of the few counties in Pennsylvania who does have that level of care, which is paid by medical assistants in the county. So the people who really need that level of support will have access, 24-hour supervision, 24-hour access to medical, 24-hour access to psychiatric service. In addition, we've also, we have HUD funding, as you probably know, for HUD apartments for individuals coming back from the state hospital if they need that supported level of care. The county also has a level of care called supported, well, we call it supported housing services, but if someone is a high-level intense need, then we can add those mental health services as well. So I think the beauty of this is we can do individual planning, right? The challenge is, yes, in some ways, the whole personal care home, we used to have like 3 huge personal care homes. And then the state said, you know what, we don't want all those big personal care homes. We want to go down to smaller ones. And that has been a transition that's been difficult for a lot of the providers. But the importance, I think, is you have an individual plan coming out of Warren. You have your individual service plan that wraps the individual and what is needed with not only all the Warren State Hospital expertise, the community, if they have a blended case manager or someone else who's been active, as well as family, they can go to that meeting and give input, right, on John's needs. But in addition, we also have, again, this independent advocate who knows the system well, works within that hospital system, and can speak to need. Waiver, and I think we probably could have a whole hour about waiver, and I'd be happy to do that in another occasion, because waiver's another whole issue that isn't available unless it's physical health for people with
Okay,
mental
what
health
about
needs.
the waiting list for individuals that are waiting to get HUD housing?
That's prioritized by need and disability level. So people with very high need, we have what we call a master list meeting that I sit on every single month, and we review the people who are awaiting those services and prioritize according to need. Which is the best, because there's never going to be enough resource for demand, right? But the best thing you can do is assess need and be sure that the person who has the highest need and highest priority is well wrapped and secures the service.
It sounds like Erie County has thank you. It sounds like Erie County is pretty comprehensive, much more than some of the rural areas. And I think I just want to acknowledge that we are really blessed in that.
Kathy, you know, you can tell that you have lots of experience in the system too, because that is the truth. There are people in other rural counties who don't have that opportunity, which is, I think, why they've extended mental health to the Mental Health Association's advocate to be able to support others. So, okay. Thank you, though. Great questions.
So for now, I'd like to talk a little bit about our biggest program, which is our daytime drop-in center. So we're open Monday through Friday. Right now, we're open at 7 a.m. We're getting people off the streets as quickly as we can till 4, and then the upper room is open after that for a couple hours, and then it is also time to head over to our neighbor's place. But of course, with Emmaus, also, people have an opportunity, you know, to get dinner. So again, it's always a coordinated event effort, and my favorite saying, as I wrote in my little bio, is it takes a village, Sister Val, yes. Because people that we have come through our doors flow through other places. So again, we usually know when somebody's struggling. These are the things that we offer through our consumer center at MHA. We have now, it's an enormous amount of people coming in. Of course, for everything, life slowed down during the pandemic. Took a couple years to come out of it. But typically right now, we're averaging, 120 plus. We used to get so excited when we'd get like 80. Now it's like 136 is like our new max, or our new, big number. That's people flowing in and out. And thankfully, we have an opportunity to make sure that our doors stay open, so people are safe. So when somebody comes in, they become a member, we do kind of an orientation, a real quick kind of, packet of contact information. So from that point on, they get a membership card, which identifies who they are. And by having that, everybody knows you belong here, which makes a big difference. So when people come in, they come into what we call triage, so it's our front lobby. So we have a chance to just kind of get eyes on people. Hey, how are you doing? Welcome. Remind people no drugs, no weapons, no alcohol. Again, we're a place of recovery. Now, I'm probably going to knock myself out if I keep moving, so I'm going to try not to do that. Jeez. And then somebody can just come in and do absolutely nothing, just be safe. Or they can be involved in any of those activities. So come in, get a hot cup of coffee, a donut, a bagel, fruit, sit and watch some TV, look at what's happening in our world, sign up to take a shower, do your laundry. We provide a free meal every day during the week, and I think we're at about 10,000 meals right now since July 1st. So, and again, with all of us having shared life experience, what we especially do in the winter is it's carb loaded. So we want to make sure it's sustained energy for somebody. Just in case they can't get to Emmaus for whatever reason, they have something that will get them through the next day if possible. We literally have no leftovers because we give them away. So we go through the rounds, and then whatever we have left over, we just put out for everybody. That's our goal. And thank goodness the Second Harvest Food Bank, because they make everything so affordable for us. So grateful for that. We also have NAMI, the National Alliance of Mentally Ill of Erie County, who provide an art support group twice a week. So that's kind of a nice opportunity for members just to express themselves. We also have other providers that come in, Community Health Net. Not everything made it on the list, so we added more things as time went on. Community Health Net comes in on Wednesdays for a couple hours. They do virtual medical appointments, which is wonderful. We have Central Outreach who comes in also to do kind of follow-up and appointments. There's probably so many I can't even remember, honestly. And thankful, anybody who wants space to come in, which is great. And Sarah, I am going to give you a big shout out. And so I know you're not going to like it, but I'm doing it. Sarah from Hammett Build has been a godsend to us and started just doing volunteer work for us in our kitchen. And now she's a nurse, and she's doing a tremendous amount of follow-up with people who have had, of course, traumatic experiences at either a doctor's office or an ER, just don't trust people. And so it's great with Sarah and a couple of the faith community nurses too, who, boy, if you're sick, you don't want them on your doorstep because they're going to drag you out. So, which is a good thing. So thank you, Sarah.
Pat, can I talk about the collaboration, some of the collaboration efforts that you've had?
Yep.
I'd like to share a story with you. I was executive director of St. Patrick's Haven, which is an emergency overnight homeless shelter for men. And in September of 2022, I got a call at 11 o'clock at night saying that our shelter was on fire. So I went to the shelter and we lost everything. and we could not open, which meant that that night I was scrambling to find beds for 24 men who had no place to go. This is September and winter is coming and it's going to be cold. So at the time, there was a group of us that met every week to discuss how are we assisting those experiencing homelessness and mental health issues with COVID, because we were trying to get people vaccinated and trying to let them know where to go to the bathroom, where to get a cup of coffee, just basic, activities of daily living. So I went to the meeting that Friday and I said, we're done. I mean, we are dead in the water right now. I don't know what we're going to do. We need to open. Does anybody have any place at all that could give us some space? I left the meeting, and 45 minutes later, I get a call from Pat. And Pat said, we have a lower level. We can't do 24 beds, but we can do 22, and it's yours if you want it. And you can stay there as long as it takes St. Pat's to rebuild. And we were there a year. And it was a wonderful, wonderful partnership, partly because many of the folks who came in our door also came in your door. So when I put the word out on the street, and among the homeless sector, when you put the word out on the street, it spreads like wildfire. They all know right away. But they felt comfortable because many of them already come there. So to go there to sleep was almost like going home to them. I don't know what we would have done, but Mental Health Association provided the ability for 22 people every night, and we were full, 22 people every night during the worst months of the year to not have to wonder, where am I going to sleep? That's the kind of collaboration that they do with members of the community. And I just wanted you all to know that because it's a remarkable and such a generous offer.
Another shout out as long as we're doing this, and that is just because I think when you work in a nonprofit or in a for-profit, there's a lot of rules. And as we know, someone who has mental health challenge or substance abuse challenge or is chronically homeless, meaning more than a year on the streets without stable housing, individuals have a very short, what we call time horizon. In other words, all they can think about is, where am I going to get my next meal? Where am I going to put my head tonight? How do I stay safe on the street? Without an ability for a leader, an executive director, like Pat, what happens is any change, positive change, the situation Betsy just described, right, it all slows down to a crawl or turning the Titanic. I don't think I've ever known in all my years working in mental health anyone who can turn a situation around as fast as Pat Stucke. What can the Mental Health Association do? How can we make this happen? And then she calls the executive board and says, here's what I'm thinking about, and the next day it's done. So I thought this is a good place to put that little shout out in, because having been on a lot of boards and experienced nonprofits, this is not something that can happen. But that collaboration that Betsy and Pat worked out like that was totally amazing, and it happens over and over at the Mental Health Association. What do people need? Let's get it.
Colleen, speaking to that, when you talk about the turnaround, let me tell you the turnaround. 16 days after our fire, we reopened. Now, we lost everything. We had to recreate the entire program. Pat found us cots. We salvaged things. We kind of begged and borrowed and said, hey, anybody can help us. 16 days, we created and reopened a program. Could not have done it without Pat and her team. Would not have been possible.
And she told us not to say any of this.
But she is one of Erie's unsung heroes, and she deserves to be recognized. Do we?
Moving on, Pat.
Let's move on to the
Okay,
next
thank
slide.
you.
Here we go. Let's talk about
There we go.
social stigma and isolation among those with mental health and those experiencing homelessness. When you are experiencing mental health issues, sometimes it's all you can do to get through the next minute. You're trying to deal with what's going on in your head, the voices in your head. And sometimes the next minute is all you can do. Now, let's couple that with homelessness, and let's couple that with addiction issues. So the one nice thing about the Mental Health Association is there are a lot of people there to help people figure out, what am I going to do in the next minute? They're not necessarily focusing that person at that moment on, what are you going to do next week? because they're recognizing it sometimes it's just the next minute. And these are some of the things that our folks, that they experience. That they have a disconnect from their family, a disconnect from the community. A disconnect, as Colleen said, with time. Time element means nothing. And I can tell you that there have been times when I have taken folks, I've said, hey, you've got an appointment, I'll take you to the doctor appointment. It's Tuesday at 10, I'll meet you here at this time. They don't show up. It's not because they're no-showing, it's because time has no element. And so when they go to the Mental Health Association, there are people there who can help them get a grasp on what that time element is so they can get the services that they need. They're not being difficult, they're not no-showing because they want to. It's because this is the best they can do. And they recognize that, and that's okay. Many of our folks have strained or broken relationships with their families. And I know sometimes holidays are very difficult for these folks because they are living with, oh my gosh, I no longer have a family, or they're remembering good times or bad times, and all of those memories keep flooding back. But the MHA is a safe place where they can go and they can explore those feelings with other people who get it, who have walked that walk, who can come up to them and say, I'm really sorry that you're experiencing this, I understand. And you know that they understand because they have walked that walk. So I think it's really important to understand where somebody with mental health is coming from. It's a really tough road to walk.
I'm going to jump in for a minute because we had talked about some statistics, and being kind of the data girl, I thought this might be interesting for you. So as Betsy was just sharing, and we talk about stigma and challenge, around 30% of people who come into MHA are homeless. And as you'll know, 10% of those people are probably what we call chronically homeless, meaning they've been out, have had no stable place for over 1 year. The other people also, what we find is they have an apartment, but maybe the supports have dropped away. They have the apartment with their family who help to provide resource, and maybe that family system now is strained and the family has dropped away and the person loses their apartment. And as you know, downtown, I'm going to go a little sideways to share this with you. Downtown right now, the average one-bedroom apartment costs $745 a month plus utilities. That's Erie, PA, $745 plus utilities. I'm going to share with you, none of you would like to live in most of the apartments that are going right for that price. Once in a while you can get one for $6 something, but you're not going to want to live in it. So with that said, as you know, that if someone receives disability from Social Security, from the what we call DI, disability section, meaning they've worked in their lives and now they're on permanent disability, right? If their income is not high enough to reach a standard of $963 a month, then the federal government gives them what we call supplemental security income, SSI, to reach that minimum. So the average disability and retirement, the same over 65, is around $963 a month. What we are finding then is you take that $745 apartment. Anybody here have a gas payment per month of like 20 bucks? Because if you do, I want your house, right? So you take your average gas payment and you add it in. You take your electric, which now is higher than gas, we've noticed, right, because of the way resources have changed. You add that in, you get a phone, not much left, right? Nothing usually. Usually, you know, people are trying to rob Peter to pay Paul to keep their utilities on. So I just want to share that because I think a lot of times there's confusion around, well, if you're on disability or you receive retirement benefits, why can't you keep an apartment? Well, that's one good reason. The second thing we wanted to share from data-driven information is that they have done recent research that shows that our soldiers, United States soldiers, American soldiers who come back from a war situation, 1 in 3 experience symptoms of post-traumatic stress disorder, PTSD, which I know a lot of us are familiar with, if not from personal experience, movies, TV, right? They have flashbacks, nightmares, challenges with emotional regulation, all that under your PTSD diagnostic label. New research shows that 3 out of 3 individuals who have survived chronic homelessness have PTSD. So you think of war as, well, I do, my husband's a Vietnam vet, so I think of war as like the worst thing that could happen to anyone, and his experiences over the last 50 years still prove that. But then you look at people who've been on the street for a year because of the risk of physical harm, people with chronic homelessness, their medical and physical health needs are rarely met. There's just so much risk on the street. And for women and assaults, we won't even go there. But the idea is they are not safe on the street. So at their PTSD level, imagine that, 3 out of 3. In other words, every single person who suffered chronic homelessness has a diagnosis of or could be diagnosed with PTSD. The last little stat I want to share is that we have also received recent information from the National Alliance of Homelessness that says 67% of individuals with chronic homelessness were abused either sexually or physically as a child. 67%. So it isn't just someone doesn't want, sometimes people say, well, Colleen, don't you really believe that people maybe don't like to be in shelters or they don't want to be in homes? Well, not because they're making that choice, right, from a quality of life perspective. When you think of that number, here's what I think of. Having worked in children's mental health a large portion of my life, here's what I realize. A 7-year-old, right, who comes to any of us and says, I'm being physically or sexually abused, what happens immediately? Our empathy takes over, our protective side takes over, right? We want to save that child. You want to do everything you can to be sure that child is not at risk. Now fast forward 20 years, and that person is coming to Emmaus for dinner, or they're coming to MHA inside the door. I have a gentleman who just texted me this morning. Don't know where he got my number, but anyway, he texted me this morning to tell me he only had 1 boot. He's living outside. 31 years old, had a stroke. He's living outside. He had 1 boot. When he went in for a free shower to the Y, someone stole 1 of his boots. 1. Now that they're messing with him, but obviously he's carrying everything on his back, right? So back to the stigma. But he has so many challenges, and he's always saying, oh, thanks for helping me at the end, because he knows he had his first stroke at 27. So he's very aware of how he was before and how he is now, and how difficult it is for us in the community to be able to talk with, collaborate with him. He's very aware of that. But at 27, we forget that he was the 7-year-old, right? That our whole heart went out to him. At 27, that's a little trickier. At 57, it's even harder. So I think, if we think of that data and realize that these are not individuals who just want to, as my neighbor said a couple of weeks ago, he probably wants to drink his money so he doesn't want to pay rent. I did such a good thing. I just said, no, I'm not really thinking that's probably true. And I said, oh, I'm sorry, I got to go. Because you know what? When you really, right, have worked with individuals who are struggling like this, you realize nobody would wish this for themselves, would they? No one would. So, okay, I'm getting off the soapbox, but I thought that those informational pieces, and when you think about the research that's now coming through, it's pretty amazing. And then I think it kind of helps us maybe to kind of just tune in and open our awareness to the fact that we are doing what we can to support people. They are doing what they can to meet us and meet our needs as well. For coming to appointments, for accepting services, for coming and being quiet as they have their meal. And that's what it takes, is I think empathy and understanding all around. Okay, I'm done.
There's a question back here.
It seems like the homeless population seems like it's increasing. It seems like it's also changing. From what I've observed, it could be the individual in their late 50s that worked their whole life. They might have worked maybe as a paramedic, maybe as a nurse, and then suddenly they've seen so much trauma over the years to other individuals, like the 7-year-old you were talking about. They just can't work anymore. So now they're like in their late 50s. They are trying to get SSDI or SSI. It takes 2 years to do that. So in the meantime, when they have no income, where you get the younger people that are maybe like 20 years old, 18, that came from, like, let's say maybe a stable family, but there's something traumatic happens to them. They get severely depressed. I mean, where's the additional funding come to aid these individuals? I mean, there's just so much money that's available. Are there additional funding streams coming? Or does the county have additional money? I mean, you mentioned the project with the individuals that maybe be chronic homeless, but it seems like that number can be increasing, and there's like wait lists. Just my thoughts.
Can I add one more thing to the homeless picture, and then Colleen, I'll give it to you. I want you to recognize that homelessness is not just the person who has a mental health issue or an addiction issue. And I'm going to tell you right now, any one of you in this room could be homeless tomorrow. Do not kid yourself. Look at what happened in Southern California with the fires. These are people of means, and a whole community is homeless. How many people in this country literally are 3 paychecks away from being homeless? You suddenly get hit with a job loss, an economic downturn in the country, in the world, it doesn't matter, an illness that suddenly hits you. You never, ever know. So please don't think that it can't happen to you, because it can. And so nobody gets up in the morning and says, gee, I think I'd like to be homeless today. Sounds like my life plan. Nobody says that. But thank God that there are services out there like the MHA that open their doors that say, we will help you navigate this. We can't fix this for you, but we certainly can help you navigate it. So I just wanted to make sure everybody was aware that it isn't always just because you've got a mental issue or you have a drug and alcohol issue. It can be life issues as well.
That's an excellent question, because Pat, I think in the beginning of your statement you mentioned about people with burnout. And I have one of my favorite members who was 59 years old, worked his entire life in Erie at a manufacturing plant. The plant was taken over, and 2 months later they said, oh, and the pension fund is empty. So now he's 59, he can't get retirement until he's 62. He could work, yes, he's very depressed, but he could work, but who hires a 59-year-old machinist? As it turned out, no one. So that's the kind of thing, and he was telling me that he had $41,000 in the bank that he had planned to put with his pension that evaporated, and he spent the $41,000 living, and then he was on the street. So I think you make a good point. The face of homelessness is changing. What I know from our neighbor's place, which is the seasonal overflow shelter you heard about from Josh Aker, who talked before, whom many of us volunteer for, we are finding that the face of homelessness has changed dramatically in the last 2 years. Number one, more younger people, 18 and up. We never had an 18-year-old. Well, this is our 13th year for the overflow shelter, and I know I don't want to take much away from MHA, but MHA housed us at the overflow shelter during COVID, so they're all in, and their staff volunteer there as well. So we have 13 churches, right, in our 13th season. 18-year-old, 19-year-olds. We have more geriatric people than ever. I use that term loosely because now that I'm geriatric, but the reason being is that we never saw, what we saw was about 25, 28 to maybe late 50s. That's what we usually saw. We have just placed in housing out of the overflow one 74-year-old man, homeless. We have had three, right, Sarah? Now we have 2 individuals who are deaf, who are also there, who both are older. One's in their 50s, maybe, and 70, maybe, somewhere in there. That we haven't had before. And we had a younger gentleman who just left recently. More women than ever before. It used to be a single shelter for guys, really, and it was whoever couldn't be housed at the traditional shelters or St. Pat's. We do have still men, don't get me wrong, a lot of men, but more women than ever before. And the number one thing that you see with the women, all you have to do is look at them. Trauma written all over their faces, all over their faces. So the face, I think, as you said, of homelessness has occurred. I know we don't have much time left, so I think the funding thing, Pat, you're striking the nail right on the head. That's always going to be an issue. It might be more of an issue as we move forward here. We'll have to see. We just got information that 50% of the HUD staff have just been let go or are in the process of being let go. What that means is, I don't know, does that mean our HUD monies will come back, which means that people who are the highest priority won't get housing? Does that mean that maybe they just won't be able to do very good, well done, efficient utilization review? I don't know. But what is a program without utilization review? In my world, it isn't. We have to be sure that programs do what they're supposed to do and the way they're supposed to do it, and that they have positive outcomes, or there's no point, right? So we're going to wait to see, and I don't think any of us at this point can answer that question. So we'll just wait and see what works, and hopefully the decisions will be made for efficiency, and we'll still be able to keep people in levels of care that they need.
Can we talk for just a moment about who these people are? Because I think you need to know. The people that we deal with are incredibly, or work with, they are incredibly well-read. They are very bright. They are absolutely talented. I have read poetry that would knock your socks off. I have read stories that people have written. Colleen, if you'd like to speak a little bit about artwork, we have seen just incredible, amazing levels of creativity that have come out, and they've shared with us. But I think it's important to know, just because somebody has mental health or just because someone is homeless doesn't mean that they don't have a brain, doesn't mean that they don't think, doesn't mean that they're not creative, because I'll tell you what, they're probably more creative than you and I are when you look at it. When you look at some of the artwork, but this is just a couple of samples. Absolutely.
I'm borrowing Betsy's now. I just have to share with you that this picture is supposed to be Isaiah, biblical Isaiah. Isn't it gorgeous? I'm going to get a little emotional. I once at the Overflow we had a young man in his 20s who couldn't be on his cot. He was up, he was down, he was bothering his neighbors. He just had a horrible time. And when the lights went out, he got worse. And so I sat next to him and we talked, and he told me that he had had an assault, a horrific assault, that he told me about. And I said, well, how can we keep you here tonight out of the cold? Because it was in this, one of the Erie winters, right? Really horrible night. Anyway, he told me all about this horrible assault he had, and we had this long conversation. It was very amazing, very amazing. So he got a chance, we called, and he got a chance to go back to his family. We tried to put that back together. It didn't last long, but it did last for a while. And one day, I'm in Emmaus, volunteering in Emmaus, my second favorite place, first favorite place. They go back and forth, MHA and Emmaus. Anyway, somebody says, oh, somebody left something for you. I thought, left something? This was it. He had a little note with it that said, just want to thank you for the conversation. Is this the most beautiful thing you ever saw? And one of our artists who lived at St. Pat's and also was an MHA member did this. I had to take that off my wall. I have 3 of his on my wall, but this one was so portable I brought it. And he also is one of the individuals who there is a group of homeless individuals who meet monthly with one of our faith-based nurses, And they got together, and he draws the entire time when he's seeing or talking to you. He just died very recently of an unexpected illness at 50, but he is the one who thought of the map. Have any of you seen the map? There is a map for people who are homeless that this group thought of themselves, and they put together. It's color-coded. It has a QR code, and you can go and look. So you can see where all the meals are in Erie, where the medical services are, where the library is, where the trolley goes, where the shelters are. And he was instrumental in putting all that together. And he also was kind of like this father figure at MHA. All the young people who come in would wind up with Greg somehow. He'd be talking to them about something, and kind of, if you ever had someone on the street you were concerned about, you'd say, well, when you go to MHA, or here's Greg, and he would kind of usher them through. But that kind of heart, the person who says, I'm only taking one pair of socks because you might need those for someone else, and you're looking at them and they're in sneakers and their feet are soaked, but they only want one pair of socks because they want to be sure somebody else has one. It's a wonderful mission. Come join us.
I'm just thinking, surely you must run into some very difficult people. Do you feel safe? Do you ever have to call the authorities? And do you ever go home at night and worry about your well-being?
I will too.
At the shelter, I always felt safe. I never did not feel safe, because I'm going to tell you, the vast majority of those experiencing homeless, they are happy that we are doing what we are doing. And so they kind of self-correct those who might give me a hard time. So I never not felt safe. I never worried about that. Yes, I have had to call the authorities because sometimes somebody just gets out of control. And I hate to do it, but sometimes you have to. You don't have a choice with that. But what I have found is that 9 times out of 10, if you listen, nobody listens to the homeless. They don't even look at them on the street. They walk by like they're garbage and not there. They just want somebody to listen half the time. So I found a lot of times just sitting down and letting them rant. And then we try to get to the root of the problem, because more often than not, the root of the problem isn't what they're saying. It's something else. It's a trauma that happened earlier that day or earlier that week. And it's trying to get to that and helping them process it. Go ahead, Pat.
So when you think about it, MHA, we have, let's say, 120 people that are coming in. And so a lot of things can happen. People get tired of being around each other. And sometimes you just look at somebody wrong. And then here we go. But that's why the staff are there. We have what's called an ask, tell, go. So we're trying to stay on the floor to listen, to kind of intervene. And staff will go up and say, so I know the 2 of you are having some issues. So what we always say to our members is, when you walk through the doors, we're Sweden. We're adults. If you don't like somebody, whatever it is, it stays outside of our building. Because if you bring it in, then you have to deal with us. And that is basically just to hold that person accountable. And because this is all about communication, I can be mad as hell. But again, like, how am I going to deal with that? Because we will say, okay, I'm going to ask you, you need to figure this out. At the very least, the 2 of you stay away from each other. If I come back the 2nd time, I'm telling you, you have to take care of this. I come back the 3rd time, you're going. That's it. You lose your space here for the day. And if you don't go on your own, we'll call the police. And then it's going to be a longer time frame before you come back. So we're always hopeful, but again, we're here for the long run, so I might have to have that conversation 100 times with somebody. But my hope is at some point, it makes a difference. And in addition, let me just tell you, we have 34 cameras inside our building and outside our building. There's not much I can't see, because that's safety. We want everyone to feel safe. And plus, people make bad choices. Sitting with their buddy, decide to steal their phone because they look the other way, or maybe their wallet. And I tell you what, I want to nab you before you go out of our building. Because what we do, we figure out who it is. We let the person who's the victim say, I'll supply this to the police if you want to press charges. Absolutely will. In fact, right now we're involved in 2 court cases because of situations that happened in our building. It's like, that's not okay. So sometimes people have to learn kind of that tough lesson. And you asked, am I ever afraid for my safety? No. Maybe I'm too overconfident because of my relationships that I have with people. I can have some pretty tough conversations with members because we respect each other. Not that it doesn't cross my mind every now, probably twice in 12 years that I've been there, that I can recall situations where I thought, oh, this is gonna hurt. Because I thought I was gonna get smacked, because we have a hands-off policy. And not always to the best of my advantages, I'm gonna be right there in the middle of it. So I know that, okay, I gotta dance and talk fast. And sometimes it's just to distract somebody, like, hey, talk to me. Because that other person they're really angry with is behind me, like, no, see me, talk to me. Let's go here. You try to get them away from the situation. Even in our best efforts, sometimes that doesn't help. We just had a situation where somebody got really upset, and another member helped him out of the building. Because again, they're a family, and it's like they want peace. They want to enjoy their time together. But again, stuff happens in a heartbeat, and I'm thankful that, again, staff have that shared experience. They kind of get it, and they listen. Not that we catch everything, but I get to be the eye in the sky. So they call upstairs and say, Pat, can you check the camera? I'm like, yeah, I know who it is. I know who was doing drugs in our building. I know that fell out of his pocket. No, I don't buy that story, it's not mine. No, that was your pocket. Good try. But again, I think it's always an awareness, So, and I think it's always, I call it a heightened awareness. I'm always going to be mindful.
Mental health and homelessness are loud, right? Like in my home, nobody raised their voice. No one raised their voice when I grew up. My mother gave you the evil eye, right? And you were really quiet, but nobody raised their voice. And what you find is both mental health and homelessness, it's loud. And so people have a tendency to be loud. And once in a while, we have a guy who comes almost every day to MHA, and he's so loud. And I said to him one day, wow, I couldn't quite catch what you were saying because it was so loud for me. And he goes, oh, was I talking loud? I thought, whoa, yeah, it was like a hurricane coming at you, right? But it's true to get your needs met. A lot of times when you come from those situations, people are loud, and it's not even an awareness, but it was so cute because I thought this was coming with the force of a hurricane, this conversation. And one of our other members said to me, Colleen, are you okay? I said, yeah, I'm fine, because he wasn't yelling at me, he was telling me this terrible story. But the loudness, I think, is another thing that they're really good at, because they just kind of wander around and say, hey, will you tone that down a little bit? Or, what were you talking about? It sounded like it was, something really was going on. And those conversations and relationships make all the difference.
If I can, I want to backtrack just for a second. Pat, I just wanted to respond with this. You were talking about funding. The future right now is unknown, but what I can tell you is in the nonprofit world, we're resilient. We're used to doing the dance. And as Betsy shared, and what goodness came out of COVID was a stronger bond amongst all of us. Like, how can we help? How can we help each other? Because that's all we have. And we wait and see how things kind of roll out. That's okay. It just takes me a little longer to get that.
I think it was very kind that you offered your agency when you knew you had like an open space in the basement, but you had to probably juggle funds around too for your program and kind of, let's say, take the bite, because when you get an extra 22 people in there, you're going to have more toilets flushing, you're going to have more water, you're going to have more electricity. That's going to put a drain on, it seems like you're pretty much line item budget is probably maxed out. But it was really cool and very kind of you you had to make your own line items juggle in order to aid like another individual. To get 22 people, that's going to jack up the electricity. It's going to jack up the water. It's going to jack up all these other things. But I mean, you did it. It seems a lot that you were willing to do that.
And
Some
I can tell you, not to interrupt, but I can tell you, St. Patrick's Haven, we paid our portion. We figured out what percentage of the building that was, and that was the percentage that we paid. So we worked together. We figured this out. We figured all of these things out before we ever moved in, so that it wasn't going to be a burden. It was kind enough that Pat opened the space, but we wanted to make sure that we would never be a burden.
But it was also collaboration, too,
Absolutely.
you know, which seems like you have a very good relationship with other agencies, which seems like, especially now with this new quote, homelessness, you really kind of have to, you know, in order to make it work for the consumer.
Thank you.
I can say as a board member with St. Patrick's Haven that the cooperation and the spirit of working together with the MHA was so vital to providing the services that we do for the homeless men at St. Patrick's Haven. And it's something that it shows that we work all together in a network and would help out anybody else if we had the ability to do that. So that's, you know, something that we all have that common cause about. And it's just something that maybe because we have the heart in mind and the spirit, that's why we do these things there. And there's no animosity or, you know, a competition, you know, who can bring in the most people or that thing. It's not even close to that at all there. So, Pat, I do have a question. Actually, if you don't mind, a couple questions, and it's not interrogation or anything.
Okay.
Okay. In the situation where you have to have somebody removed by the police, have you had good luck with, because I understand the police departments are now being trained in mental health, you know, on how to deal with those sometimes volatile situations there. Are you having some good success with that through the Erie Police Department?
Absolutely. We actually were on the front end when they created the crisis unit for the police department. So we did some training with them. We had them actually come into our building so people could get to see them in just their street clothes and get used to seeing faces.
Right.
We are a resource contact for the sergeant of that you know, unit, and they have been extremely kind and compassionate, but yet firm.
Right.
So we usually kind of set it up. So we have it where one of us in senior staff comes down into the lobby. We talk about what the situation is. And so it's not a big spectacle, that it's just really for that person that we need them to leave. So their response time to us has been absolutely wonderful.
Well, that's good.
And thankful for it.
Yeah, and I think all the police departments in this area, and actually statewide, nationwide, are getting more involved in the mental health aspect. And that's great because it helps, you know, looking at it from a mental health perspective instead of something else, you know.
Right. Well, let me just say too, John, and calling the police is like the last thing that we do.
Oh, God, yeah.
So, you know, I mean, you work through all of it as best as you can. So they know when we call, it's because we need their help.
Right. It's a situation you can't control anroom, and it needs law enforcement.
Yep.
So, one other, I remember a few years ago, Holly Tacone was heading up a program there to get Vivisac's for people that were not, for some reason or another, not able to live in the shelters. And, you know, for this way, because there were people either they couldn't live by the rules or they didn't want to stay in a shelter. Is that program still going where they're providing the bivy sacks? You know about that?
Holly has been doing it a lot on her own with
Okay, that
other
was on her
friends
own.
and family, and she did join the Erie County Home Team
Okay.
as well. And so she's still out there doing her good work, yes. And
Okay.
she's found a smaller, I understand.
Smaller, yeah.
Yeah, the
I call them
smaller.
something different.
Yeah, they've
Okay,
changed
yeah.
it to shelter
Yeah.
bags. So she's found some of those, but I know that mission is still in her heart. I don't know that it's as robust, but she's still
Okay,
working
yeah, I know
toward
she
it.
was going great guns on that there, and I know I promoted at one of the shows. that I
Oh,
was
she's a great
doing, so,
person.
yeah.
She's worked very hard.
Okay. Okay. One other question, and I'll end up with this, and I don't want to get into a long discussion. I know you probably don't either. When it comes to, you say there's no drug use allowed, okay? And I understand that no alcohol use allowed. What about the situation, should you have a resident or person that has medical marijuana? What is the position of Mental Health Association in regard? I'm not trying to stump you or anything
Oh,
like
sure.
that. I mean,
Yep.
that's one of those things that's very debatable. So I'll leave it at that there for you, Pat.
Well, thank you, John.
My work is done.
Yeah, it is. No. So what we look at certainly is if somebody has a medical marijuana card, that they are able to have that on them, but we're considered, even though a nonprofit, we're a business, so we can set our rules and regulations, which means not in our building. Simply that. And so when laws change and they may become more flexible, then we will adjust to that. So, and we have many more people now that have medical marijuana cards because it's more common, because they've expanded kind of the diagnoses that you can receive it, which is good. It's a good option for many people. Absolutely. Good question.
I'd like to kind of speak about the staff for just a moment. When Pat hires somebody on her staff, it is not a job to the people that she hires. You cannot work with this population and have it be a job. It is because you have a ministry, you have a calling for this. Because if it was just a job, you wouldn't last. There's no possible way. So Pat has assembled a team of people who are called to serve those who are walking a really hard road. And that is commendable, that she sees that in people as she is going through the interview process.
And did you want to mention Ed, who did the interview here on the earlier commercial? He is now working there. And he said to me yesterday, he said, "Oh, best job I ever had." It's, so it's really great, isn't it? And you provide volunteer opportunities too for people to see whether that would work for them.
So the team of 10 right now that's in our consumer center, and Ed is one of those individuals. Of the 10, 5 actually are our members who we have hired. So in addition, then we have individuals who have that addiction, who have experienced homelessness, and have a history of criminal justice. So again, there's not much that we don't understand or have not experienced ourselves, which helps us to work the long days, to put the time in and know I'm going to have this conversation 300 more times with you. But that's okay because we're in it for the long run. That's the bottom line.
Would you like me to replay the commercial?
Sure, we can do it at the end. There's too much to share.
Sometimes life throws you or someone you know curveballs. You might be facing mental health challenges or perhaps struggling with addiction. Maybe you just need a supportive place to help with these challenges.
The Mental Health Association, or MHA, is a safe and accepting place. Our staff and many members understand these struggles firsthand. We've all walked similar paths and possess the experience to support you on your recovery journey.
We are dedicated to making sure everyone feels not just welcome, but supported. We offer many activities at our Consumer Recovery Center. There are opportunities to volunteer if you are looking to give back. You can even do laundry or take a shower. All services are free. Yes, free.
More importantly, you'll connect with like-minded individuals who will help you to develop a strong sense of belonging and coping strategies to better handle those curveballs thrown at you. You can be part of a community that knows the importance of mental health and addiction recovery.
The Mental Health Association is here for you. We offer a safe and welcoming place with experienced professionals ready to listen and share their experiences.
I think I just want to kind of, wind up with.
Sometimes, like.
Okay.
Didn't mean to go there.
We do love that commercial.
I'm just trying to get back to the.
But again, anyone is welcome if you'd like to take a tour to see, our building. We have 30,000 square feet. We use every inch of it. And our lower level, which is not on this video, that'll be another one someday. But that is kind of more of our quiet space where we actually have sleeping cots for people. We have individuals who work third shift and they're exhausted. They come in and sleep. And it's also a place to play cards. We have a little library, just something a little bit different. So I'm going to ask the two of you to help me take one. So there was no easy way, and I didn't put them on the PowerPoint, so I'm sorry about that. But just going to kind of bring those around. So we're hoping in the springtime this will be finished so that you can see this. This is in our driveway. So we are now looking at, there's not a whole lot of green space downtown, right? So we worked with a landscape company in McCain who created this. He and I chatted and he saw our vision. So this is space that people are going to have to go outside when things are tough. Yeah, fresh air and just put your feet in some grass, and just give yourself a moment to breathe. And that's what we're hoping. It's handicapped accessible, so thankful for the Department of Human Services and the county executive who agreed with our vision. So just something different. So again, of course, Colleen has to come over here. It's the same one. Give it back. Anyway, again, if you'd like to actually have a tour, please just stop by anytime. We can make that happen. We're always happy to show our space off. So, are there any more questions? We're thankful for all of you who showed up on a cold Friday to learn a little bit about us. And hopefully, too, that gives you a chance to check out all the other nonprofits in Erie who do so much great work.
I just want to thank you in the MHA for the wonderful work that you do. It's really, really important.
Thank you. Thank you.